So what is glaucoma? First thing. So glaucoma is a group of eye disorders where the optic nerve, जो आँख के पीछे, we have the optic nerve behind the eye. The optic nerve gets damaged gradually. So उसका एक उसमें in this we have one risk factor. So there's one important risk factor for optic nerve damage. So that is increased intraocular pressure. That is the pressure inside the eye. That is called intraocular pressure. So because of that, the optic nerve gets damaged. So that is the only thing which we can control as of now. So the only treatment which we are aiming at is to reduce the intraocular pressure, right? So we have many medicines to reduce the pressure. So once the patient comes to us, we start medical treatment for many types of glaucoma. We also do laser in some types of glaucoma, that is angle closure glaucoma. And in some secondary glaucomas also we do laser. We also give medicines. Suppose the pressure cannot be controlled with these two modalities, we go for surgery. So that is one more thing. So who has to come for screening? So that is also important here. During this World Glaucoma Week, we conduct screening programs in our hospital and many other hospitals. So who has to come for screening? That is also important. So all people above 40 years, if they get a comprehensive eye evaluation every year, that is very good. And those who have trauma near the eye or head trauma, they also have to come for an eye checkup. And those who have, as madam said, high power glasses, either minus or plus, they also have the risk of having glaucoma. They should also come for an eye checkup. Those who have family history of glaucoma, as she said, and those who are already suffering with diabetes, hypertension, thyroid and other medical ailments should come for eye checkup definitely. And those who are using steroids karke, there are a group of drugs which are called steroids, which are used by many people in the eyes, in the nose, on skin, as ointments. They don't know that they are using steroids, and they have a component in their eye ointments and drops. D karke rehta hai. D means danger. Dexamethasone. There are so many steroids in the form of ointments and drops. Patient keeps on using them without knowing, and they develop glaucoma. They don't even know. They lose their vision and they come to us. So this group of patients, those who are using steroids for any other disease in the body for long term, they should also come for an eye checkup because they can have glaucoma. So ये categories जो है more than 40 years of age, everybody, diabetes, hypertension, thyroid, those who are using steroids for a long time, those who have trauma, injury to the eye and around the eye, and those who have a family history of glaucoma. All these class of patients should come for a screening definitely to any eye hospital and get a comprehensive eye evaluation done. So this is the thing. So why this World Glaucoma Week is, we are creating awareness among the general public so that they know about this disease and then come for an eye checkup. If they don't know, they will never come and they will never know that they have the disease, because once the disease process has started, they cannot know that they have the disease because it's very silent and the pressure rises and the optic nerve is damaged, and by the time they get to know, the disease is so advanced, even medications or even you do surgery, you cannot halt the disease. So there is no cure as of now. Early detection and treatment is the key to manage this disease as of now. So for that we have to first create awareness. We should know that there's something like this and we should go to the ophthalmologist to get an eye checkup done. And I advise everybody to come for a comprehensive eye evaluation, not go to an optical shop, as Dr. Rajlingam has mentioned, that we should not go to an optical shop and get our eye checkup done. So this is my plea to everybody, to the general public, to go to an ophthalmologist and get a comprehensive eye evaluation done. Get your pressure checked, angles and optic nerve examined. Thank you.